Hey class, in this recording we're going to focus on the oral cavity. As we look at the oral cavity in our body is going to be just known as the mouth. And we'll start off with some surface anatomy. We have the upper lip. Everybody knows what the upper lip is. And then there's the lower lip. So, hey, there's our low-hanging fruit for your lab exam. And as we're looking at the interior, so I'll go ahead and remove the skin here. We can look at the interior of the oral cavity. Let's go ahead and zoom out a bit here. And we can see the hard and soft palate. So I'm going to go ahead and dissect back some of the muscles here. So now we can see the roof of the mouth, or the roof of the oral cavity. The hard palate is going to be more anteriorly located. It's going to be located where the maxilla and palatine bones are merging together. So let's go ahead and delete this oral cavity as well. There we go. So there, now we can see the hard palate really beautifully. And then we have the soft palate. The soft palate makes up the posterior of the roof of the oral cavity. So our soft palate is located right there at the posterior. Let's recenter that and get a good view. Lovely, beautiful. At the apex, or the far posterior region of the soft palate, we have the uvula. And to zoom in on our uvula, I can go ahead and click it right there. That's just a really good view of the uvula. I'm going to double click that so we can zoom in nice and close on it. It is a singular point. It kind of looks like a speed bag or a punching bag hanging down in the back of your throat. And our next structure is the tongue. I've already removed the tongue, so I'm just going to go ahead and re-add the tongue. T-O-N, add the tongue. Boom. So now you can see our tongue, or at least we should be able to see the tongue. Let's go ahead and click on it specifically right there. To get a better view of the tongue, you could open up your mouth and stick out your tongue at the mirror, but because we're working with visible body, I'm going to go ahead and clean things up a bit, get rid of all the teeth at once. So there we go. That's a good view of our tongue right there within visible body. And then we have some tonsils. We have the palatine and lingual tonsils. We already talked about the tonsils with the immune system, but since these tonsils are intimately associated with the oral cavity, we're going to include them again. So, as we're looking for our tonsils, the lingual tonsils are going to be on the posterior of the tongue. Let's get rid of the skeletal system entirely here. And let's get rid of the muscular system entirely as well. And also those endocrine functions, and let's get rid of all the ligaments. So we've really cleaned it up. And now I can add the tongue back in. And the reason for this class that I went this way is because I want to expose you to the lingual tonsils on the back of the tongue. So as we're looking at the lingual tonsils, they're going to be located here in the posterior of the tongue. This view is not working very well for us, so we're going to go to the microanatomy view to really highlight the lingual tonsils. So if we go to tongue regions, there we go. We can then click on the lingual tonsils on the posterior of the tongue, directly posterior to the valate or circumvallate papillae. And then we also are going to have the palatine tonsils. Those are going to be really on the left and right margins of the tongue, of the posterior of the tongue, whereas the lingual tonsils are going to be on the posterior medial margin of our tongue. I'm going to go back to systems view, and let's go back up to digestive, upper digestive. This was the view I started off with. Here we go. When we look at gingiva are just known as the gums And then teeth. You all know teeth, but just to make sure I officially told you, there I have the teeth highlighted teal for you in this figure. So that's all we're going to talk about for this video clip. In the next recording, we're going to focus on the teeth and parts of a tooth. If you have any questions or comments, please post them in the class discussion boards. And as always, happy studies.